Good morning. I'm Russ Mitchell, and welcome to 7 Minutes, coming to you today from the main campus of University Hospitals. Our guest today has been head of the University Hospital systems for coming up on 11 years now, and with the seismic changes in the healthcare industry we have seen this year and beyond, this is sure to be one of the most challenging times of his career. Here to help us talk about that and to give us some insight perhaps into himself is Tom Zenty, the CEO of University Hospitals. Mr. Zenty, thanks for being with us today. We appreciate it.
Thank you. It's great to be here.
March 3rd, your 11-year anniversary. In your time here, what are you most proud of?
Well, this is an extraordinary organization. We've been in existence since 1866, and we've had a lot of accomplishments in that almost 150-year history. Since I've arrived, I've been very pleased with everything that we've been able to do on virtually all fronts. Our quality of care has received national recognitions in more than one arena. In 2013, we were selected to be part of the U.S. News & World Report Honor Roll Hospitals, one of only 18 hospitals in the country. Cleveland is now one of only 5 cities in the United States with 2 hospitals recognized on the Honor Roll.
That's fantastic. What's your biggest disappointment in that time?
Oh, I don't feel like I can ever really do enough, and so our limitation is always time. But in spite of all that, we've really done some remarkable things here at University Hospitals and taking care of the patients who we care for, doing the research in which we are so committed in our relationship with Case Western Reserve University, and teaching the next generation of caregiver, both physicians, pharmacists, physical therapists, and other clinicians, caregivers, and non-caregivers alike.
Let's talk about these seismic changes in the healthcare industry. How would you describe the state of healthcare in this country today? What word would you use? Confusing? Understandable? What?
I would say opportunistic. In times of great change, there's always great opportunity. And I think the biggest change that we're seeing today in healthcare is that we are seeing more and more consumerism now coming into place than we've ever seen before. In previous years, we've always had supply-induced demand. We are now looking at demand-induced supply. And so as a result, for example, just in November of this year, the reports just came out that the lowest number of inpatient admissions to hospitals in the past 50 years nationally has occurred in hospitals across our country. And I think we're seeing significant changes now in that people are having to pay more for services, do more than they've ever had to do before to take care of themselves, and have more ownership for staying well involved in preventive care and the lifestyles that they lead, and in seeking care through the most appropriate channels.
Well, kind of take me through this with the changes from an economic standpoint, from a procedural standpoint. 2 scenarios here. I'm a patient. How is the world changing for me?
Well, it depends. So if you are an employee, 80% of employers now on a national basis have high deductible health plans. So before you're able to seek care, you will do more comparison shopping than you've ever done before. If you're a Medicare patient, there will be more restrictions and requirements for you as a Medicare patient to make certain that the care that you're receiving will be done under the most appropriate arrangements. There are now limitations on how much people will be able to receive in terms of benefits for Medicare coverage. If you're going to be enrolled on exchanges, as you know, there have been some challenges in terms of getting enrolled on the exchanges. I'm convinced, though, that they are technical glitches and that those things will be resolved. But at literally every level, we're seeing significant change in how people will be accessing care.
A variety of things happening there. Absolutely. Okay, I'm an employee. You have 25,000 employees here. With this new world, is my job less safe than it was 2 years ago?
I think we need to be prepared for everyone's jobs to perhaps take on a little different perspective than they've taken before. And as we take a look at our industry, there will be growth areas in some arenas and there will be decreases in others. And I think that we have to be thoughtful about, as employers, about how we're going to be encouraging people to seek new opportunities that will be arising.
Let's talk about Cleveland and the incredible medical community that we have here. How would you describe this rivalry, if that's the right word, you have with this place down the street, the Cleveland Clinic? Is that a fair word, rivalry?
From my perspective, healthy competition makes everybody better. And if we take a look at Cleveland, I've said this in every forum that I can, and I'm happy to say it again today, and that is we live in one of the best healthcare cities in the world. Not in the region, not in the state, not in the nation, but in the world. I
know you got one of your master's degrees from New York University, so you spent some time in New York. You're familiar with the whole Yankees-Mets thing. Kind of a similar deal here, Yankees-Mets?
That's a hard analogy for me to even comment on.
I see. Let me ask you this then, in terms of this friendly competition. Recently, University Hospitals got the deal to become the major health provider for the Cleveland Browns and a major sponsor. Taking that away from Cleveland Clinic after almost 40 years. Why was that deal important for this hospital to make?
Well, there hasn't been a deal announced as of yet, but the moment there is, we'll be sure to give you a call.
So what we've been reporting for the last couple of weeks is not necessarily true. I just want to make sure I understand we're talking about the same thing here.
None of the information that has come out to date has come from a university hospital source.
Okay. If there were such a deal, Mr. Zenty, why would it be important for the university to make a deal like that?
I think you're leading the witness.
Okay, fair enough. Let's talk about you for a second. You like to renovate houses. I understand. What does that do for you in the other parts of your life? What do you get from that?
Well, it's not limited to houses. I used to restore antique cars when I had the time and a much younger point in my life. But it's like anything else that you would do in business or other parts of areas of interest that you may have. So, for example, in every house that I've renovated, you have to start with the right location. You have to have the right infrastructure, and from there you can build almost anything you want. The same is true with an automobile. You have to have, first of all, the right frame. You have to have the right year. You have to have the right make, the right model. Once you have that and it's established that it is indeed the kind of car that you want to restore, you can basically make it anything that you want. And the same is true in business.
Sure.
When you create a vision and you create a strategy. So, for example, every house that I bought, to use your example, the moment I walked in the door, every one I renovated, the moment I walked in the door, I knew exactly what I wanted that house to look like. And 12 or 18 months later, my vision was almost always created in that particular instance as it relates to me. Here it's different. We're a community benefit corporation. We're now into our third strategic plan at University Hospitals since I've been here. That's involved the board, it's involved our medical staff, it's involved our employees, it's involved members of the community. And so that's where I gain a lot of my satisfaction, and I'm able to transfer the same skills from what I did in my personal life, my professional life as well.
I've got about 45 seconds left. I understand when you were in 10th grade, you knew you wanted to be a hospital administrator. How does one come to that decision so early in life?
I had a great mentor. I had a local physician. The town in which I grew up in was a very small community and was not a particularly wealthy environment. And a great work ethic, great sense of values, great sense of community, great family. Local physician in town wanted me to get involved in medicine. I said I'm interested in the science and I love the rigor, but I was more interested in population and population statistics. And he said, why don't you think about hospital administration? He said, I think that could work for you.
And it's worked out for you?
So far, it's worked out pretty well. Yes.
Favorite car?
Oh, my favorite car? Yeah. Antique or new?
New. Got 8 seconds.
I haven't seen it yet, but I think I might like the brand new Corvette Z8.
Not bad at all. Okay. Tom Zenty, thanks a lot.
Thanks for having me.
We appreciate it.
Great to talk to you.
And that is all for this week. I'll see you Monday at 6 o'clock on the news and back here next week for 7 minutes. Enjoy your weekend.